Rogaine for men hair loss. Let's see if you're a candidate for it. Minoxidil or Rogaine is a medication that has been in the market for a long time. Initially, Minoxidil has been a high blood pressure medication. So it was used to lower blood pressure, and the doctors who were treating patients realized that some of these patients are growing hair. And they started focusing on that and using it for hair loss treatment. And then they made it into a formulation as a topical called Rogaine and put it in the scalp to minimize the miniaturization and improve the male pattern hair loss. So medication has been in the market for many years, and it has its own group of candidates. Many people could respond to Rogaine. Some people may have better options. So if you want to break it down, men with typical male pattern baldness could use DHT blockers or finasteride. That is probably the most effective line of treatment for this group of patients. But if you have side effects of sexual side effects or any other side effects with finasteride, you can use Rogaine topical minoxidil as the next option. So Rogaine should be used topically. It comes in 2% and 5% solution and foam, and the best use of it is to be used twice a day. However, if you cannot use twice a day, once a day may not be bad either. People who use Rogaine initially within the first few weeks, they may have excess shedding because it seems like it's increasing the turnover of cells. So you may feel like the existing hair sheds more before you can start growing new hair. So don't be alarmed, let it go, continue with Minoxidil or Rogaine through that phase, but after that you start seeing the new hair starts becoming thicker and thicker. So basically, if you have a lot of miniaturized hair, a lot of baby hairs that's going through hair loss, with Rogaine you can minimize that and you can make some of them thicker. By doing that, overall you see more visible hair on the scalp and the volume of hair will get better. You have to use medication for at least 6 months to see any visible improvement. So if you're using it for only a couple of weeks or a couple of months, you may not see the full result of it. And be aware of the fact that Rogaine has this condition called catch-up hair loss. So if you improve your hair because of Rogaine, when you stop it, you may lose hair a little bit faster, so you can actually catch up to where you were supposed to be. So as long as you use Rogaine, you're good, but if you stop it, you may lose the effect of it or most of the effect of it that has been gained. I hope you learned from this video about Rogaine and its effect for men. Thank you for watching.